Over 23 years of doing mammography, I've seen a lot of changes.
As manager at the Southtowns Radiology in Hamburg, Dr. Diana Agluski oversees an office that conducts between 9,000 and 10,000 mammograms a year.
The digital mammography is probably the biggest change that we've seen in the last 10 years. The imaging is superior to what we had with film screen. We can see so much more, so many little details. We're finding cancers earlier and earlier. That's exciting.
Not only is the process precise, it's also easy on the patient.
You register, you come into the room with the technologist. She's going to ask a few questions, just give you a little bit of a history on the patient. It always helps the doctor with the diagnosis. Then we get right into the actual exam.
The procedure itself goes by pretty fast. The technicians here at Southtowns Radiology do more than 200 mammograms a year, each.
It's nice to be able to chat about other things, not just what's being done at the time. Our technologists, because they do these every day, day in and day out, they can talk to the patient, just have a regular conversation with them, as well as getting the production of the mammogram done. So the patient really doesn't even know what's happening, and by the time they're done, they're like, wow, was that it? And yeah, that's it.
Once the technician captures the 4 images, a doctor can immediately look at them on a computer monitor and adjust the magnification, orientation, and brightness to get the best possible view of any problem areas.
And as soon as he dictates, it goes right off to a fax, and their referring physician does get the results right away as soon as they retrieve it from their fax. And then the patient is given a verbal report.
Getting the results only takes 10 to 15 minutes, which can be a pretty long time to wait.
I always tell my patients, I've been on the other side of this exam, so I know how it feels. And I think that helps. They know that, you know, you've been through this, you know how I feel right now, and they're anxious. So at least you know that person's been through this before and has sat in their seat and knows that feeling.
Then every mammogram at Southtowns ends the same way.
We give the patient a flower at the end of their exam, and there's so many of the ladies who look forward to that flower and their letter at the end, knowing the results, walking out of here knowing everything's fine, or I do indeed need to have something else done so that I know 100% that I'm okay, or I need to take care of myself. So I think the patients appreciate that. Rather than having to wait, a few days to get the results from their own doctor, they're walking away from here knowing exactly what's ahead of them.
When it comes to breast health, knowledge, information, and communication are the most powerful tools on the market.
If women have to get breast cancer, let's find it at an early stage where it's treatable. And